Hi there, I'm Dr. Fonza. I'm from Neighborhood Vet Clinic. Today, we're going to chat about something that we often see in our practice, and many practices at that. Foreign objects that are ingested by pets. Super common, and it's kind of hard to know as a pet owner what to do in this particular circumstance. Do I go to an emergency clinic, or can I wait it out just to see what happens? So today we're going to go through a few questions just to give you a rough idea on what we recommend to do in certain circumstances, such as ingesting a foreign body that your pet might have gotten into.
So, what is the very first thing a pet owner should do if they suspect that their pet has ingested a foreign object?
It's a great question. So there's a lot of confusion on what exactly to do, but the first thing that we should be doing is instructing the pet owner to take that object, remove it from the pet if possible, take that object and put it in a bag if we can, because that gives us a lot of good information to go off of, because now we know what the risks are associated with that particular object that was eaten. Always call your veterinarian, so call us. We're just a phone call away, and we can help better guide you on what to do in that particular scenario. Because like I said, some of these objects can be either objects that'll pass really easy, or are objects that are actually of a concern and can cause damage if we don't instruct the owner properly on what to do.
What would you say that the most urgent symptoms would be that we need to go to our emergency clinic?
That's another great question. So symptoms that we do see that might indicate more of an emergent visit to the emergency clinic, we're going to be thinking of pawing at the face, if there's something stuck in the mouth that's causing an issue. Repetitive vomiting over and over might indicate that there's a serious obstruction. Difficulty breathing, if they're having a change in color to their gums, if dark color, bluish, might indicate possible an airway component to this obstruction as well. And then also, if we're experiencing some abdominal discomfort, if you pick your pet up and we're yelping, even sometimes I've seen dogs where they've presented to me doing almost a downward dog pose over and over. So any new repetitive behavior, such as downward dog posing, might indicate a serious obstruction. But especially if you touch the abdomen and they yelp or they're uncomfortable, that can definitely indicate something more serious is going on.
So, if it's not an emergency, what should be the first step that owner does?
Right. So I think in this case, it's still very important to play it safe. Give us a call. Let us know what the situation is and what if you know what object has been swallowed. That gives us a lot of good information to guide you in the right direction. Sometimes it's okay to actually wait and kind of see if the object passes. So for example, if we've got a rock that's maybe this small, and let's say, for example, it's a German Shepherd, it's a pretty sizable dog, it's probably going to be okay, especially if the dog's not exhibiting any symptoms currently, to let it pass on its own and watch for symptoms. However, if we have, let's take a dachshund, for example, ingest a rock this big and the pet owner knows for sure this is the size rock that was swallowed, we're going to be a little more concerned. So we're going to want that pet to come in, get some precautionary x-rays just to see if we can establish where that particular object is located. At the end of the day, it's still just better to play it safe. Call us. We can guide you further on what the next appropriate steps are to take. Our first and foremost concern is the health of your pet, and we're just a phone call away.